Philippine Nurse listeners and followers. Kumusta po kayong lahat? We hope you're all doing well. And thank you for joining us today at Philippine Nurse. And of course, as you know, Philippine Nurse is brought to you by the PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. So, September 16 is National Voter Registration Day. It is the biggest day of the year to make sure that our communities are ready to vote. And millions of people across the country will be checking their registration, updating their information, and encouraging friends and family to do the same. So the voter turnout rate is a mathematical expression that indicates how many eligible voters participated in an election. And a variety of factors can factor into the calculations of this so-called voter turnout. So the voter turnout rates are expressed as the total number of ballots cast in a jurisdiction divided by the total number of eligible voters in that jurisdiction. So the voter turnout rates have expressed a percentage of eligible voters. And according to Ballotpedia, the voter turnout rate for 2022 was 46.2%, but it also rose to 63.9% in the 2024 election. Still, this is not good representation for eligible voters. So today, we have invited an advocate for voting who will explain why voting and health goes hand in hand. So please welcome Dr. Elizabeth Fildes.
Thank you, Doris. Thank you for having me. Thank you so much. Thank you. The nurses are supposed to be advocates for patients.
Correct.
Part of that advocacy is to ensure that there's representation by the patients they serve. And
so,
representation means that you have a voice, and your vote is your voice.
Yes.
And so that's why we want to ensure that the populations that we serve get to have their voices heard by registering as a voter.
Yeah, well, I have a series of questions for you, and I was going to introduce you, but Dr. Elizabeth Fildes is not a stranger to us and to our community, right? So you are a Filipino-American nurse, leader who had demonstrated passion and still demonstrates passion and sustained commitment to improving the health outcomes of people in Nevada and also in the Philippines. I mean, you had the tobacco use, addictions. You are so very passionate about this, and you are mobilizing healthcare providers to provide interventions and therapeutic interventions to improve the population health. So you're doing a lot. I cannot even spell out all the letters behind your name.
You're doing a lot.
And she's also a Fulbright scholarship of the the fellow of the American Academy of Nursing and the International Nurses Society on Addictions, correct?
Yeah.
You have anything to add to that?
It's a mouthful. So, a Fulbright specialist. And lately, with Vote ER, by the way, there's a fellowship that you can apply for, and they train you to help you mobilize your community.
Okay.
So that's what I'm doing.
That's
I'm
what you're doing now, right?
Vote ER.
Yes.
Yeah.
Okay, we'll get to that in a minute. So, why you are a person who, among the many organizations and advocacies that you're involved in, you have taken on voting registration. Okay, so can you explain why? And I know that there is a direct correlation between voting and health. Can you explain that collaboration?
And that's exactly why I am engaged in this fellowship. And voter registration is an upstream, meaning it's something that we need to fix in order for health to flourish in our community.
Yeah, correct.
Right? So the research is showing communities where there's a lot more civic engagement, i.e. voting, right? The members of the community are engaged, they're voting, they're speaking with their legislators and all that stuff. The research is showing that if they're engaged, their social determinants of health are so much better. They got better schools, they got better housing, their access to health care is better. So very important that, and on the other hand, communities that don't engage, meaning lower voter registration, suffer the consequences of lack of resources to become healthy.
Right.
And so we want to mobilize the communities that are not represented in our democracy by getting them to vote and really passionately be engaged in advocacy so that their mothers and their grandparents, their children, are beneficiaries of a better system, better environments, better school systems, better healthcare access,
right,
et cetera, et cetera.
Right. So that right there, you had explained the direct correlation between when you vote and its direct correlation to health. And also you had mentioned something about the social determinants, right? Okay, so social determinants of health, which is are the conditions in which people live, where they work, and where they play, that can also influence one's well-being, correct? But researchers are now saying that civic engagement should also, which includes voting, should also be considered a social determinant of health. Okay, and that's, do you have anything to add to your other previous explanation?
So for the same reason, because voting will determine the conditions where the conditions that could help people thrive and become healthier, right? So same thing, big thing for us, right? Medicaid is being cut, and so potentially access to health care for a lot of people will be cut. And so that is a very important issue for Filipinos. For all nurses, we take care of those patients, right? We take care of those patients. And therefore, yes, this is very important that we help people be engaged in advocacy and vote so that they influence those social determinants of health that can possibly help people become healthier.
Right. So you're saying that health and voter participation, this has to be reciprocal, right?
Absolutely.
To be reciprocal, so that if you are registered to vote and you can vote, then you can vote about health issues, things that you want to be covered, and they're not wages, right? Okay.
Access to care is so important for us. Right? And housing and school systems.
Correct.
And public health infrastructure. All those things are very important, which are decided by our legislators.
Legislators, correct,
And
correct.
so part of civic engagement is, you have to be a voter and you have to hold those legislators accountable to you. They report to you. Should never be intimidated by to go and speak to our representative because we elected them to their office.
That's correct.
Right?
That's
and
correct.
so they're there to work for us. Right? And so as nurses, very important to be an advocate for your most vulnerable patients by going to your representative, represent the people who you serve, together speak to your legislators about the issues that are important to your patients, as well as to the issues that are important to your general welfare as a nurse.
Right, right. So, do you have any numbers or statistics on the voting participation among healthcare workers?
That's very sad. The research is showing from this study was done in 2021 Journal of Internal Medicine, I believe, or General Medicine.
JAMA, I think.
Huh? General Medicine.
Right.
Anyway, the research shows that healthcare professionals in general are 12 to 23% less engaged in voting. So we have to not just our patients, we have to mobilize ourselves, our healthcare professionals. That's why Vote ER started this movement. This was started by an emergency room physician because she realized that because the people who are underrepresented in our democracy, the young, low income, and people of color are majority of those who do not vote.
Yeah, correct.
And so she said, and yet they're the frequent visitors of emergency rooms. And therefore she saw that opportunity. And for us nurses, right, Doris, the most trusted profession, how about us really
initiating the
process, and
right?
by the way, Mr. Jones, are you registered to vote? So I was speaking with someone who is also engaged in voter registration. He's doing it in a different way, and he says when they come for taxes and they start, his clients start to complain, then there's an opening to say, by the way, are you registered to vote? So that you just are not complaining, but you are making your voice heard.
Correct.
Okay.
So, is there an implication of nurses and other healthcare professionals in advocating for civic engagement?
Oh, absolutely. Absolutely. Things that we complain about, right? We say our patients don't have the resources. I can't discharge these patients right now because they don't have a place to go home to. I can't discharge these patients because they're not eligible for home care. Right? And so we have to do something about this. And the American Nurses Association Code of Ethics requires us, right? It's in our DNA. It's in our DNA. Advocacy should be in our DNA, right? And advocacy can be at the bedside, right? Can be at the bedside. However, it needs to go to the organizational level when you want policies to be changed at the organizational level, right? Nurses do it collectively. And then at the state level, right, where a lot of, so the research is showing that we're so excited about, you saw the voter turnout for the presidential election, right? That was a huge turnout.
Turnout.
Huge turnout. And yet, so many of the decisions that we live with every day are made in the state and the county levels.
Right.
Right? And therefore, we really need to engage. And some people, maybe some nurses, some nurses would say, well, it doesn't matter. My vote doesn't matter anyway. No, that's not
I hear
true.
that all the time.
Yes.
My vote doesn't count. Yes, it does.
Right.
Yes, it does, right?
There are local elections, for example, I heard somewhere in Henderson, where they recounted and it's equal. So they had to toss a coin as to who will take the position. So your vote matters. Your vote matters. There are elections, local elections, rural area elections where the difference in number would be like 12, 13 votes. So your vote matters.
Yes. And that's why it is so sad that the voter turnout is really low.
Absolutely.
And we're even talking about Asian Americans, Filipinos, for that matter. I mean, a lot of us, I think, are not even registered to vote, or don't want to go vote. I don't know the numbers, but for me, I guess I know. I don't know. I have to go vote. Doesn't matter whether you send it in or I personally want to go to the polls.
Yes, absolutely. There's something about it.
There's something about it that makes you feel I did my job.
Absolutely. And there's get this, suffragettes, nurse suffragettes, were there in the beginning. They were fighting.
That is true. They were fighting for it. Correct.
Right?
Yes.
And so we stand on their shoulders and honor that sacrifice that we say we have to vote.
Yes.
We have to vote.
Okay, so let's talk about Vote ER. That's how you pronounce it, right?
Yeah.
Vote ER. Okay, so I'm looking at my notes, and it says voter registration turnouts have emerged in healthcare settings across the country. And in 2019, Dr. Alistair Martin launched a pilot program in the waiting room of the emergency department of the Massachusetts General Hospital in Boston, where with iPads, where patients could register to vote. So his work has expanded to the Vote ER, a nonpartisan civic engagement nonprofit, which now works with hundreds of institutions and about 50,000 healthcare workers to help patients register to vote and vote while they are in the hospital.
Yes.
Right.
Yes.
So in 2020, Vote ER had partnered with healthcare professionals and institutions to register people to vote. And this is a cross-sectional study that analyzed the demographics and the voting behavior of the people mobilized to vote in healthcare settings, including hospitals. Now, I know this is your passion, and I know that you are part of the Voter ER. So, Dr. Fildes, can you tell us about this movement?
So it's very important that it's nonpartisan.
Correct.
The research is showing that if we mobilize, the more people vote, then the more the decisions are so much more representative of our will, of the collective groups of people in a community. And so that's why Vote ER is teaching fellows like me how to mobilize their communities behind voter registration. And one of the most important tools that we have is that nurses can wear this badge, and that when they ask patients if they're registered or not, they can, by scanning the QR code, and they could register to vote, and they could also find out if their registration is up to date.
Okay, so
just QR code,
and they can use their phones.
Yes.
For this.
Yes.
Yeah, the camera on their phone.
Right,
So
right.
we are showing you, some pictures about Vote ER here on the screen, and also captured in there that you'll see is the QR code for you to scan so you can actually register to vote.
Yes,
That's
exactly.
awesome. That's awesome. So,
Exactly. The key to getting people to engage is convenience.
convenience.
Right? It's convenience. And for nurses, you don't have to be an expert on things. You just say, Mr. Jones, here, let's check if you're registered or not. If you're not registered, you can register by doing this. And then it links Mr. Jones to all kinds of resources that is needed to respond to Mr. Jones's questions.
Right.
So the nurse does not have to answer all those questions. She does not have to be the expert, but click this QR code and it links the patient to all these resources.
Okay, this is wonderful. How many of our hospitals are tuned into this? Not many yet?
No, I don't. Unfortunately, I don't believe we have a hospital that's tuned into it.
That is so sad.
It is very sad. So my strategy is to work with the Healthy Filipino American Nayon.
Right.
Link leaders within our 42, is it 42 Filipino American organizations?
It's
that we have?
47 now.
47 Filipino American organizations in Las Vegas to adopt the Vote ER badge. And we also distributed through Philippine Times.
Correct.
Remember, this was on Philippine Times, and I tested it with that. They could also scan that QR code.
Yeah, you have engaged associations, like you said, the Healthy Philam Nayon, or the HFAN, as we call it, to make this as our advocacy. I'm also part of HFAN, by the way.
You.
Yes, and
Thank you.
Help write the one for the Philippine Times. How's that?
Thank you.
Yeah.
Thank you so much. Thank you
anyway,
for your help.
I am a firm believer that you have to be registered and to vote, and to have your voice heard. So why does advocacy matter?
For the many reasons that we just talked about, right? So promote equity, representation, right? Representation. And then we know that the research is showing that the more engaged we are, the better our community outcomes are.
Correct. Okay. So what is well, there should be a mission and vision of the advocacy, right? Which is to get people to go and register and vote, right?
And so the mission of the Health HFAN advocacy is to empower Filipino Americans who are members of these different organizations, to empower them to have the tools to engage in civics, to effectively advocate. And being a registered voter is a powerful way to demonstrate that.
Very good.
Right? So in the process, when we vote, we advocate, then we have a voice as to how our communities are to be respected in terms of what our needs are and all that stuff. So, very, very important.
Very important. So, aside from partnering with organizations, to make them have this Vote ER as part of their initiative, what are the rest of it? What's your strategy to beyond the organizations to achieve the goals?
So right now I'm hoping to be in touch with student nurses associations.
Okay.
So I want to be in front of them and share what I shared with you, and then bring this right there, and then at the after the talk, then this is available to them, right? And it's so important, I think. It's unfortunate that as nurses, we're not so engaged in advocacy.
Well,
we're not so
that is
engaged in
true.
advocacy. And so I want to start with our nursing students to show them that their vote is powerful, that they have a voice, and their vote is their voice.
Yes. And it's very important. That's part, or the big part of your strategy, because you're an educator. And we have a lot of Filipino nurses who are educators.
Yes,
So
yes.
let's get them into
working
this
with
program.
them. Working
right?
with them.
Right?
Yes.
Okay, so what is the conclusion for this movement?
The conclusion is we want to get Filipino Americans to register and vote.
Yes.
That, and then we will track our outcomes down the road. But right now, we want to mobilize people. Get Filipino Americans to register and vote.
So, yeah, and voting is, like you said, it's a democratic right. And it is a determinant of health. If you haven't seen the connection yet, hopefully we have explained it to you that there is a direct connection between voting and health. Correct? Okay. All right. So what is your call to action to the community?
Register, please.
Right.
Register to vote so that your voice is heard, and never, ever underestimate that voice. Collectively, we can change things around.
Very good.
For our patients, for the people who we love, and for ourselves.
Yeah. That's good. Well,
Okay.
thank you so much.
Thank you
Dr.
for
Files,
having me.
Yes,
Thank
I know
you.
this is short and sweet, but thank you so much for joining us today to talk to us about this very important topic. And we definitely, appreciate all you do. So, but before we sign off, here is something to reflect on for the audience. 62% of unregistered voters say they've never registered before simply because no one asked them to. Okay, right? And every year, 83% of the people in the United States walk through doors of a medical facility. Okay, so that's just not a statistic, it's an opportunity. Okay, by weaving voter registration into the everyday healthcare interactions, we're not just helping people to register, but we're deepening the trust between providers and the patients. In fact, when you ask about voting during a medical visit, many patients say they feel more genuinely cared for beyond their physical health, right?
Beautiful.
So recent research also shows that healthcare-based voter outreach reaches a younger and a more racially and ethnically diverse population than the traditional political campaigns. So as we look ahead into the elections, medical professionals may play a pivotal role in shaping voter turnout. And we hope that we can get the attention of some of our CEOs there so that they can participate in this important matter. And so long-term, expanding voting access through healthcare equity initiatives isn't just good policy. It's a powerful way to address the root causes of inequality in historically marginalized community. Right?
Beautifully
Thank you.
said.
Okay, so here's our call to action. Whether you're registering for the first time, updating your address, or nudging a friend to do the same, take the step. Be part of the movement. because being registered is the first step on being heard, right?
Beautiful.
Right. Thank you so much again.
Thank you.
Dr. Fildes.
Thank you so
And
much.
Thank you so much for listening and joining us today. Please be safe and be well. Until next time, this is Doris Bauer, your Philippine NARS host, signing off for now.
Just like a friend from back home. This is your Filipino radio experience in Las Vegas. PHLV Radio.